Thank you, Dr. James Berry, for doing this presentation. And I would like to introduce Dr. Berry from MGH, MGB. And Dr. Berry provides care for people with ALS. He is Winthrop Family Scholar in ALS Science, Director of MGH Multidisciplinary ALS Clinic, also Chief of Division of ALS and motor neuron disease. And we've got such a privilege of working with James on many different projects. And we're really excited to have Dr. Berry actually share with us about digital monitoring for at-risk participants with ALS and also what we are doing with different programs, especially with familial ALS digital study. Thank you, Dr. Berry.
Yeah, absolutely. Thank you so much, Indu, for having me, and thanks to everybody at Everything. I'll start by just acknowledging that this is an Everything ALS study with support from our team at Mass General Hospital, and the whole thing is funded by ALS Finding a Cure. And without that funding, projects like these can't go forward. So it's so incredibly valuable. And so I just a huge thank you to ALS Finding a Cure. So I'm going to talk about the digital monitoring for at-risk participants with Everything ALS, and sort of that's being meted out as the familial ALS digital study. I'll say at the outset that I will do my best to hew to the best terminology, the most sort of appropriate terminology for people who are living at genetic risk for developing ALS, and that if I make a mistake, I apologize. Please, anyone feel free to correct me. It's an evolving field, and I think with evolving thinking about the terminology, which really does matter, because we're trying to capture a complex situation and time for people who are living in this situation. So one of the concepts with this is that people who are healthy but carry a gene that puts them at risk of developing ALS, or a gene mutation, I should say, of that puts them at risk of developing ALS, take a different kind of monitoring. We're in a different situation than people who are living with symptomatic ALS. And there are real opportunities. That is to say, biologically and clinically speaking, when we begin following people once they have developed symptoms of the disease, it can be hard to understand where the disease, what was the sequence of events that really started the disease, and biologically, what was the inciting event. So that's sort of an opportunity. And the challenge is that, the timelines are different. What we're looking for is subtle. And we're really trying to get, really detailed information about that sort of first event. So it's a different way of thinking about monitoring than we are used to in symptomatic studies. I think we did this part already. So this sort of asymptomatic study, the study of people who are healthy but carry a gene that may cause ALS, really requires us to take a holistic view of what's going on with people in this situation. So we want to think about their speech, their motor function, and cognitive function as well, and do that in a way that's also sensitive to the situation that they're in, and not over pathologizing, if that's a word, not sort of reading into every small thing that might happen. We understand that life goes on, and we miss a word here or there, we stumble on a curb. These things happen, and we need to know when is that just an event, and when is that something that heralds something potentially more that needs more investigation. And in order to do that, we probably need a lot of data. The way that we're used to following symptomatic ALS is by bringing people in every month, every 2 months, every 3 months, and doing some measurements. And that is adequate. It's probably better to, if we want to have more power in a clinical trial setting, it's probably better to bring people in every month than it is to bring them in every 3 months. More frequent measuring is more helpful. But if we're really looking for, are things normal and then beginning to change in a way that is meaningful, we need to quantify all of these functions, I think, with a finer tooth anyway, more carefully, and more quantitatively, and do that in a longitudinal fashion. And then we have to contend with the fact that people who are healthy are living their life and don't want to be, hauled into the hospital or the doctor's office every month or every 2 weeks or once a week. So we need to find a way to incorporate our monitoring into their everyday life. We can do that at home using digital technologies over time in people who harbor these ALS genes but don't have any symptoms, as well as in healthy individuals. And I think the key there is that we need to know what the normal variability is. We need to know, how often do people just stumble or trip over a word or say the wrong word? And it's sometimes. It's not never. We know that, but how frequently? And the better we can get at knowing what the spectrum of healthy and normal is, the more we can say, well, this maybe is something more than just we would expect by sort of living life or chance alone. Also, in order to do this, EverythingALS are really experts at creating secure digital platforms to store and share anonymous digital data, and or even if it's not anonymous, carefully monitored data with speech researchers or with accelerometry or digital researchers who are doing good research to really help us understand the disease, and do that in a global way. That takes a lot of smarts on the digital side, and that's something that EverythingALS has in spades. And so that's I think one of the benefits is that this is not going into a black box. This can be shared. It can be shared securely. It can be shared in the right ways. That's critical. And we're integrating this digital data with clinical and biomarker data from DIALS or the Prevent ALS study, so that we can see how our digital measures compare to our traditional measures like ALS Functional Rating Scale, or other sort of ways to monitor symptoms that are much more kind of intuitive or low tech, which is sort of to ask people how they're doing. And so it not only allows us to kind of compare the two, it also allows us to look at where they're complementary. Digital data does some things really, really well, and clinical data does some things really, really well. And they're maybe not completely overlapping, but if we can complement them, then we may be onto something really important. So the study is for people who have tested positive for ALS or FTD-related gene mutations and don't have any symptoms, or are at risk for carrying one of those gene mutations. So they're a first-degree relative of someone with ALS or C9 FTD and are at risk of carrying a causative gene mutation. So, a parent, a sibling, child is a little more complicated because we'd have to know what side of the family it came from, but we could work that out. So that puts people at risk of carrying these genes, and they don't need to know that they have it. They can be in that situation too. This is for adults. It's a little more complicated to do these studies for people who are under 18, I think for very clear reasons. And ALS and frontotemporal dementia are adult onset diseases, and so we're doing this in adults at this point. I think anytime somebody enters a study, they can, and really I would say ought to ask what's in it for me. And part of the reason it's good to ask what's in it for me is that you're clearly going to be doing things for the study. You're going to be doing things to support the effort. And if you don't have a clear idea of why you're doing that, it will become burdensome very quickly. And that leads to, I think, less data collection and also just less happiness. You should be proud of being a part of something and and feel good about that and understand why you're doing it. In the case of this study, you can contribute to research about the at-risk state for ALS, and that may be very, very relevant in our understanding how to prevent the disease itself in the future. But it also helps us understand ALS. It gives us a window into ALS that is different than studying only people who are symptomatic with the disease. From a very tangible perspective, you'll have this wearable watch, the most up-to-date or most cutting-edge device from Actigraph. It's called the LEAP device, and you'll have that free for use over 2 years. But at the end of this, you can keep that watch and you can monitor your data through the Everything ALS app on your own after the study is done. And that's not typically the way this is done. So that's a real perk. You'll have personalized access to your health data in the Everything ALS app. And this is actually different than many studies, even others that I've done, which is, we always are deciding how much data can we give back, how much is it practical to give back, how much can we give back. And this, and we have to set different priorities in different situations. In trial situations, we often are limited in what we can give back. But in this situation, not only is Everything ALS built the tools to be able to give back, they've really prioritized doing that so that people have that health data at their fingertips. And I think that's just really laudable. You'll have the 2 years of longitudinal data at your fingertips as well. And there is an option, it's not a part of the study to have to do this, but there is an option to track and link your nutrition information to the study using the Everything ALS app, which is really encouraging people to eat enough calories and the right foods to maintain weight, which we know is important in ALS. So that's kind of a tool that can be linked. It's part of one package. And then also you'll know that you're linking your digital monitoring data to your Dials or Prevent All ALS data as well. The idea here is to be nimble and be responsive. So if you submit an interest form within the next 3 days, you should be connected with the Everything ALS team to learn more about the study. And you might be referred to the study from the study staff at Prevent ALS or at Dials. You may be connected through the community, like through End the Legacy or IMALS or other community organizations. Or you may just be learning through the Everything ALS community about this study. Then any of those are fine. Once you're connected with the Everything ALS team, you'll consent to the participant portal, collecting demographics, genetics, confirmation, and consent to the study so that you can receive the device, which will come, I think we have a picture of it in just a minute. It comes packaged. There's a lot of sort of very nice thought into the packaging. And also you'll have an onboarding session with your proctor via Zoom. And the Everything ALS team is very well versed in walking people through how to set these things up so that it doesn't feel daunting. I should say the watch, the Actigraph watch, comes with an app. It's called the Centerpoint app that goes on your phone. So that connects the watch to your phone so that you can get all that data into your phone and up to the cloud, but also into the Everything ALS app. You'll be walked through how to do that. It's not complicated, but it's nice to have help. And then for 2 years, you can have ongoing monitoring. There's free living data collection. So that's, while you're wearing the watch and living everyday life, it's collecting data about how you move and how those movements are carried out, how many of them, how fast are they going, and all of that gets uploaded. There's a lot, I think we take step counting for granted because so many devices do it, but it's tricky business, and those algorithms are actually still improving. So having that raw data for us as scientists is really, really important because we may have very new insights into the data. It may not just be step counts, and we've been working on this with the Everything ALS data science team, not just to look at step counts, but to look at how those steps are carried out. And there may be much more data than just how many steps does one take in a day. And so, having that raw data is really, really valuable. And we may find really, really detailed things in it that, we just simply couldn't do from commercial devices. There are also proctored sessions, and those happen about every 3 months. And those are to collect speech, also go over, any of the digital data collection, answer any questions. And then every 6 months, there'll be an ECAS session as well. The ECAS is a cognitive behavioral scale that looks at sort of how people are, managing things like shifting around ideas and holding on to main ideas in their head and performing some of these tasks. It's digitized. So what Everything ALS has done is taken this paper pencil task and allowed it to be done over the computer kind of remotely in a way that is quite impressive and really worked with the designer of the ECAS study to get that done and get that done right. So this gives a really complete picture from a digital perspective of how people are doing. So just to kind of dig into this a little bit more, there's the independent sessions are really just um, kind of over 2 weeks wearing this watch to capture motor activity. And then the proctored sessions are the speech, as I think I talked about, and the Edinburgh Cognitive and Behavioral ALS Screen, or ECAS. And that's sort of put into an app form as well and delivered in the proctored session. I mentioned before the shipping box that's really quite nice. And you can see here that this shipping box is sort of different than what you get from a lot of endeavors. And there isn't much thought put into sort of how we deliver these things to you, but quite the opposite for Everything ALS. How it's presented to you makes it feel, I think, less overwhelming. At least that's our hope in doing it that way. And what it contains is this actigraph watch with a wristband, and then the charger, which fits onto it very, very easily. It kind of just snaps onto the back. It's not even really a snap. It's just sort of held there by a magnet. There'll be a user guide. You'll be walked through connecting that app and the watch. And then there's the Everything ALS app, which is where you'll interact with questions, making speech recordings, answering questions about your health, but also seeing all of the data that you've put into this study, so that hopefully that will be a kind of a motivator to see how much you're giving to this study. So I want to pause there and take any questions. And Indu, I don't know if you wanted to add anything to what we've outlined about this study from the.
Yeah, I think to outline also what does the total, effort that takes, because I know there is a lot of things that's going on, but it's really very minimal effort.
Yeah.
And if you can just talk to that, James, I can just add to that.
Yeah, I mean, I think the whole point here, it's a really good point, Indu, because I've talked about this app goes here and that, and where you can see the data. One of the reasons that we do this through Everything ALS is that on the back end, there are a fair number of things that we're thinking about. But the reality is we want to make this very simple for people who participate in this study. So we want it to really feel like this. You get a watch in the mail, you get somebody that shows you how to set that watch up, and you wear the watch. And then every 3 months, you'll have a call to go over a couple of questions, a few questions about sort of how you're feeling, how you're thinking, and how you're functioning, and make a speech recording. That's really it. It's really wearing a watch. That's the main part of this. Most of the rest of this is how do we make it easy for you to get that watch on and get it collecting data for you. Andrew, do you want to speak at all to kind of those proctored sessions and how you
Yeah.
go about this to make it easy for people?
Yes. So we're doing the proctored session because, after talking to Dr. Barry, and we said, how do we make it easy for people so that we're not just shipping something and saying, okay, go do it. So we want you to know that we people are here to help you, support you, and coordinate any of this effort. Like if you have technical issue to just data collection. So we're also collecting the data and analyzing in line. So we know what data we're getting. So it's not like after the fact we go in and do it 2 years later, because you get the data in your dashboard. So really the effort required is like 4 hours, 4 to 5 hours per year. I mean, like literally that's it, right? 4 to 5 hours per year. I mean, we're talking about 2 years, total 10 hours for 2 years. And then you need to wear passive, the watch for 48 hours every 3 months. So it's really, 10 hours of your time, 2 years. And really, once we do this, we want to see that what is the element we can optimize. And working with Dr. Barry, we now know we don't need 20 minutes of speech. To look at speech changes, we just need, 2 minutes of speech where what we call listener effort that we have published. So we're coming up with these things to make it smaller, easier. So we need your help to do this because usually doing it with people with ALS, there's a lot more stickiness because they want to, they're actually constantly working towards managing the disease. But familial asymptomatic group, we need your help so that we don't get there. We should be able to monitor with very small footprint, very small cost for large number of people forever, right? I mean, so our goal is to make it scalable, cheaper, easier for us to do it as a day-to-day activity. So it's not like a lot of effort. So that's our goal eventually, to make it, small footprint. So
I think that's right. And that I think that's everybody's goal. I will say, there's still a few things helping you get it set up. Um, there's a steady march toward more and more people using digital devices like these, using them in studies, using them in trials, but also just in everyday life. It may be that some people are already using wearables and really have a good understanding of them. This will be very, very simple. And maybe that people have no experience wearing them. They're really designed to be fairly intuitive and easy to use. I want to talk a little bit about the data that we get from this, because um, what's different about this data and something like an ALS functional rating scale, which, frankly, it's for people with ALS. I mean, it was designed for people with ALS. What we're trying to do now is design quantitative ways to measure what's happening when people don't have ALS but are at risk of ALS. And so we can't just fall back and say, well, we should do the ALS functional rating scale. It's not relevant. We know that that's not the first thing that changes. So we need to look in a more quantitative way.
thank you. And also, I'm going to share on the chat. We had Mindy Lubb is here, and she was featured in the San Francisco CBS show, and along with us about this study we're doing. So I just have it on the link. So any questions? You can just take yourself off of mute, and if you have any questions.
Actually, this is Mindy. I have a question.
Yes.
Um, I think I was one of the first people to sign up for the study, and I'm wondering, I'm due for my next round of actigraph motions, and my question is, am I going to get a reminder about that? And if not, if that's something that maybe Everything ALS would consider doing for participants, because we do have busy lives and we don't necessarily remember to charge up our little gizmos and wear them on time.
Hi, Mindy. I can answer that question. So we get notifications within our own portal, and then I will follow up with you. I know your visit is coming up, so I will follow up with you and get that coordinated. And then our next goal is to actually have those notifications within our app. So you just have to turn those notifications up on, and it will show you your upcoming appointment within the app, and then we reach out to you.
Perfect. Thank you so much.
Of course.
Yeah. And these are great feedback. We're learning with you, along with you, and we want to make it easier for everybody to participate. So please, if you have any suggestions, please share with us.
Yeah, to that point, I'll just say, I think, we are learning as we go. We've done a lot of studies in ALS. We've done trials, we've done studies, and I think we're always getting better at those. And just to see how we've changed what we do over the last 10 years has been remarkable. But we also are building on a long, long history of lots of experience. We have a less long history, a less robust history in this kind of study. So there's a lot to be learned. So that feedback is more important than ever.
Any other questions? For people who have not signed up and who are here attending, we would love to hear from you.
I'll jump in. This is Christian. Is there any special instructions as to being able to share information about the study with maybe family members or others, or if there are any additional resources around people who may be on the fence about wanting to join the study? Yeah, thank you.
Thanks, Christian. Thanks for the reminder. So yeah, so we do have some information. It's here. These are IRB approved flyers that can go out. I think they're on the Everything ALS website as well. Um, and these can be shared to help people, find out how to ask questions and how to enroll in the study.
Hello, this is Carla. Can you hear me?
Yes.
I have ALS, but both my sisters are going to get tested because our mom had FTD.
Hmm.
So this is good. I'll forward to them if they have the gene
Yeah,
because I do.
yeah, absolutely. Yeah,
Okay.
that's exactly the situation where, you don't need to know that you have the gene. Um, you just need to know that you're at risk of carrying it.
Yeah, you can share it with them now. Yeah.
Oh, because I have it, you mean?
That's right. So you have it, which means it's, that's right. It means that they are likely at some risk of carrying the gene. So
So I almost sent this to my one sister and I thought, well, she's not been verified to have the gene yet. So
right.
I didn't.
Yeah.
Okay.
She doesn't have to be verified to have the gene yet. And
Okay, but this is recorded, right?
that's right.
Okay. Thank you.
So, and I've put the flyer in the chat, Carla, if you want to share.
Okay, thank you.
Can I ask another question? I know I'm already enrolled, but I figured we should
Yeah.
keep the conversation going.
Yeah.
Um, is there any plan to do biomarker screening for this remote study in the form of like NFL levels or anything where a mobile phlebotomist can come and add more data to the study?
Great question. And we are looking into adding in the blood draw, and we're actively looking for ways to do it, mobile phlebotomy or even self-draw kits. So as Everything ALS, we are expanding. That's something that we have been thinking about, but not actively in asymptomatic yet. But overall, that's a conversation we're having about making sure that, we understand that that's an early indication. But I think at dials that you do get NFL reading probably when you go once a year. Yeah. James, do you want to add to it?
Yeah. So in the dials program, which is converting over to the Prevent ALS program. In the DIALS program, we are measuring neurofilament on the sort of on the back end. We're not measuring it and returning those results. And some of that has to do with where neurofilament was when we started the DIALS study. It really was still a very experimental marker. It sort of turned the corner. And actually in Prevent All ALS, we're thinking actively about how whether we ought to be returning results or whether we ought to be actually creating a structure, a clinical structure for people who are in the situation to potentially seek clinical care for at-risk clinics, essentially. And there are sort of long considerations on both sides of that. Maybe both are true. It doesn't have to be dichotomous. It's not one or the other. But I think it's becoming very clear that just as the BRCA1 gene completely changed the way we think about breast cancer and breast cancer prevention and ovarian cancer and ovarian cancer prevention. Understanding these genes, knowing that we have effective therapies, particularly for SOD1, but very effective therapies for FUS in development. We really are, I think, at a point where we're beginning to rethink how do we structure our medical systems to best serve people who are at some genetic risk of developing ALS.
For somebody who is actually not in the study yet, we would love to hear from you. But if you're in the study, also share with us what your experience has been. Okay, I guess if you think of any questions afterwards, please write to us. And all our information is on the website, and also Sylvia is the lead for this. So yeah, there it is. can join the study and also contact us at any time. We're here and we have to, we want to make the familial gene carriers monitoring kind of the status quo. It shouldn't be an afterthought. It shouldn't be, so that's our goal. So help us help you. So thank you very much. Thank you very much, Dr. Berry.
Thanks so much. Thanks for having me.
Thank you.